I have a view of health that it is holistic, and that food, of course, is a major component and a very important one that we focus on a lot during this program. But at the end of the day, it still is one factor, and there are other important factors that play into our overall health. So that questionnaire covers those other aspects, which include things like sleep, exercise and movement, mental well-being, the health of important relationships in your life, like your family and close friends, sense of community in your neighborhood, your the meaning and significance that you derive from your work, or if you're retired, just from your retired life or whatever stage of life that you're at, how you respond to and handle stress. For many people, spirituality is important, so it asks questions about spirituality. And all of these play into your overall health. I mean, just to give you an example, someone may come to the program thinking that what they really need to change is their food. But let's just imagine that they're really disliking their work. Okay. And so they're not feeling very fulfilled at work. And as a result, when they get home, they're looking for something to bring them joy. Well, food is now going to take on extra added temptation because they have not had a very fulfilling workday. And then imagine they pair that then with, I deserve a reward. Not only I'm going to eat, but I'm going to watch Netflix till late into the evening and catch up on the series. And then as a result, they get poor sleep, and then they wake up very tired the next day. They wake up so tired they don't have time to exercise, and they just kind of get the day started off that way. Well, that is absolutely going to impact their food decisions as well. They wouldn't have had time to pack themselves a lunch. They're going to go get the nearest takeout during lunch. And it's kind of this vicious cycle that I see patients get into. So I ask about all those aspects, and then we actually talk a lot about it during the initial visit. And my overall goal is one, to help patients see the multifactorial nature of health, and to perhaps better be able to see aspects of their life that are not working very well that they may not have been aware of up and previously. That's number one. And number two, to see how all these components fit together like puzzle pieces, and that making one positive change in any area of their life has this sort of ripple impact, cascade effect on the other areas. Someone who starts to exercise 10, 15 minutes a day, that gives a little boost of self-confidence, a feeling of self-efficacy. With that boost of self-confidence and self-efficacy, that gives them that much more, willpower and motivation to make healthier choices about what they eat. And if they ate healthier and they got some exercise, guess what? They're going to be sleeping better that evening. So they all interconnect. And when people start to see that and get it, it becomes exciting to them, because then they just realize they're not these compartmentalized beings, but that anything they do, anything they think affects all their areas of their life. And it can be very motivating and inspiring for patients.